I know that you're an expert in early life trauma, but I want to start with the question, what is trauma? Because I suspect that a lot of people who haven't studied this as much as you have may have misconceptions just about what trauma is. They might think it's only physical trauma or something really big like a car wreck or something like that. So, how is it that you define trauma?
Trauma is an overwhelming experience that exceeds our ability to respond or be present with it. So what happens very often is we go into a state of withdrawal psychologically from the experience to defend ourselves psychologically, so that we can continue, because otherwise this would be a tremendous distraction to being present in subsequent experiences. So trauma it's an extreme experience, and I often say it's particularly in terms of early trauma, it can be a trauma of commission or a trauma of omission. And with that, I relate it to the satisfaction of early needs. And if early needs are not satisfied, they can have trauma-like consequences. And the experience can be either somebody having some physical abuse, which of course is a trauma of commission, and a trauma of omission is related to not getting an infant's needs satisfied. So for example, if there's lack of physical contact, that's a trauma of omission, and it's an important early need.
I really like that definition of an experience of overwhelm, because overwhelm has different definitions, or different people experience overwhelm over different things. And it sounds like by the clarification you gave around commission and omission, something could be traumatic simply because there was an experience that didn't happen as much as an experience that does. So what are the things that cause people to experience overwhelm? And is that different in different age groups? So, for example, is a child's experience of what would overwhelm them different than, for example, an adult's?
Okay, well, again, my focus is on early trauma, so I'm looking at early childhood experience and primarily infant experience. So an example of early trauma for an infant, for example, would be, well, birth is very often an overwhelmingly traumatic experience for the infant. What happens there is 99% of births in the United States occur in hospitals. And there are very often unnecessary interventions in a natural process of birth. So these unnecessary interventions are primarily decided by a medical doctor who is trained to do these unnecessary interventions. Again, they're not always required, but they would say it's necessary. And what they often do, the doctors now, is they'll say, well, look, this is what I recommend, and if we don't do this, this is the risk you're taking. And then so a mother giving birth would be afraid not to follow the doctor's recommendation. And then again, it's become an intervention very often cascades to subsequent interventions. And just to continue with the birth experience, very often in this country, we have what are called cesarean births, which are births by surgery, not births the natural way. So 1 out of 3 births in this country are done by cesarean, which is a very large proportion. By comparison, back in 1965, the rate of cesarean birth was 4.5%. So this has consequences. I can go on, but am I answering your question?
Yeah, I'm also just curious too, what makes something overwhelming for a young child or an infant versus, or I take it that most births or all births don't have to be overwhelming. So I'm curious what the distinction is between an experience that would simply be significant versus traumatic. In other words, birth is probably really significant for everyone, but it may not be traumatic for everyone. So I'm curious what the distinction is that makes a experience go from something that is an overwhelm of trauma versus just a significant experience.
Well, in some cases, it's personal. It's related to the person's psychological development and just how able they are to respond. Okay, if the person has many repressed feelings, which are likely due to early traumas, then that emotional repression diminishes the ability to respond to subsequent extreme experiences, because the person is repressing earlier trauma, earlier feelings, because they are beyond their ability. They were beyond their ability to respond, so they're unable to respond to subsequent feelings. So they tend to be in a state of emotional withdrawal. Okay, and often this is described in the literature, for example, a physical attack, certainly physical trauma often includes psychological trauma, but it can also be if someone screams extreme anger at you, there may not be any physical contact at all. But depending on the situation, that certainly for a young child now, they're much more vulnerable to these kinds of early traumatic experiences.
It sounds like the distinction you're making is that an overwhelming experience is one that we don't know how to respond to, or don't have a way to respond to. Is that accurate to say?
Well, again, it's not a mental choice here. It's a
Sure.
body. It's a body choice.
Right.
It's beyond our decision-making options, so to speak. And the body, what's sometimes said is the body remembers what the mind forgets. So when the mind forgets it, that's suggesting disassociation, the psychological term, where there's a lack of awareness and recall, conscious recall. So that unconscious recall gets stored in the body as repressed emotions. And during certain kinds of therapy, that the repressed emotions can be recovered and actually relived. Even birth is able to be relived. We as adults don't remember much before we're 3 or 4 years old. So the unstated assumption tends to be that if I don't remember it, it probably wasn't very important, or it didn't matter, or I wasn't, able to remember. The truth is, our early experiences, and particularly during infancy, are very important and have long-term effects. So, the lack of memory does not necessarily mean this was insignificant.